If you are taking omeprazole for acidity or heartburn, there is something important you should know. This common stomach medicine is very effective, but with long-term use it may slowly reduce an important vitamin in your body or cause various side effects, and most people don't even realize it until symptoms appear. Let's start with one of the most important long-term side effects of omeprazole. You might start feeling unusually tired, weak, or even notice tingling in your hands and feet. The surprising reason could be a hidden vitamin deficiency linked to omeprazole. Surprisingly, long-term use of omeprazole may lead to vitamin B12 deficiency. Normally, stomach acid acts like a helper that releases vitamin B12 from the food you eat so your body can absorb it properly. When omeprazole is used for a long time, it lowers stomach acid. This can make it harder for your body to release vitamin B12 from food, so over time you may absorb less vitamin B12, and your vitamin B12 levels may gradually decrease. The risk of this side effect is not the same for everyone. The biggest risk comes when omeprazole is used for a long time, usually more than 2 to 3 years. The longer the use, the higher the chance of vitamin B12 levels slowly dropping. Number 2 risk factor is dose-related risk. People who take higher doses regularly, especially more than one standard dose per day, may also have a higher risk compared to those on lower doses. Interestingly, some studies suggest that younger people on long-term treatment may show a stronger link with vitamin B12 deficiency compared to older patients. The risk is also higher in people who already have low vitamin B12 intake, such as those with poor nutrition, strict vegan diets, or diets high in highly processed foods, because their body's vitamin B12 stores may already be low. The risk can also be higher during pregnancy and breastfeeding, when the body needs more vitamin B12 to support the baby's growth and milk production. If vitamin B12 deficiency develops during long-term omeprazole use, doctors may treat it with vitamin B12 supplements or vitamin B12 injections, depending on how low the level is and whether symptoms are present. Your doctor may also review whether long-term omeprazole is still needed or if the dose can be reduced. Another less commonly known long-term side effect is low magnesium. In most cases, it develops after long-term use, often after 1 year, although in some people it may appear earlier, even within a few months, 2 to 3 months. Low magnesium level may cause symptoms like muscle cramps or stiffness, abnormal muscle movements, and in severe cases, shaking or even seizures. It can also affect the heart and may lead to abnormal heart rhythms. The exact reason why this happens is not fully clear, but studies suggest that long-term use of omeprazole may interfere with absorption of magnesium in the intestines. Now the important question is, who is more likely to develop this side effect with omeprazole? The biggest risk is in patients who take omeprazole for a long time. This side effect can happen within a few months, but it's much more common after 1 year of use. The risk is also higher if the patient is taking other medicines that can also lower magnesium levels, such as certain water pills including loop diuretics or thiazide diuretics. Special medical conditions such as patients who have had a kidney transplant are also considered at higher risk of developing low magnesium levels while using omeprazole. For managing low magnesium levels, a doctor may first give magnesium supplements if the patient needs to continue omeprazole. However, sometimes magnesium levels may not improve with supplements alone. In these cases, doctors may also need to stop the medicine for levels to return to normal. The good news is that after stopping the medicine, magnesium levels usually return to normal within about a week. There is a rare but important side effect of this medicine where it can trigger inflammation inside the kidneys. This condition is known as acute interstitial nephritis, AIN. It means inflammation inside the kidney tissue, which can temporarily affect how the kidneys work properly. The tricky part is this problem can be easy to miss because the symptoms are often vague, and many people don't connect them to their medicine. Here are some warning signs to watch for: feeling unusually tired or weak, nausea or feeling sick to your stomach, pain in your sides or lower back near the kidneys, changes in your urine like dark urine, foamy urine, or seeing blood, passing less urine than usual. And sometimes fever can happen too, although with omeprazole, fever may not always be present. An important point is this side effect doesn't always happen at the same time. In many people it can appear within the first 3 months after starting omeprazole, but in some cases it has also been reported after years of treatment. So how can omeprazole actually affect the kidneys? The exact mechanism isn't fully understood, but experts believe that in some people, omeprazole can trigger an unexpected immune reaction inside the kidneys. Here's what may happen. Omeprazole acts as a hapten and binds to proteins inside the kidney tubule. Then the body may mistakenly see that as something harmful or foreign molecules and the immune system starts attacking it. This can trigger inflammation and swelling in the interstitium of the kidneys, the area around the tiny kidney tubules that help filter waste and remove extra fluid from your body. This side effect is not always related to the dose. That means it can happen even when you take omeprazole exactly as prescribed. If this inflammation is not recognized and treated early, it can sometimes lead to kidney scarring over time, and in more serious cases long-term kidney damage or chronic kidney disease can occur. That's why kidney-related symptoms while taking omeprazole should never be ignored. Early action can make a big difference. Now, who may be more at risk of omeprazole-related kidney injury? Not everyone who takes omeprazole will have this problem, but some people may have a higher risk. This may include older adults, especially over age 60, people using omeprazole for a longer period of time, especially more than 1 month. People taking omeprazole along with other medicines that can also affect the kidneys, such as anti-inflammatory pain medicines like diclofenac, certain water pills called diuretics, or some antibiotics. And people who already have kidney disease or certain autoimmune conditions may also be at higher risk. A very important point is having these risk factors does not mean kidney injury will definitely happen. But it does mean staying alert to symptoms and following up with your doctor becomes even more important. The earlier kidney inflammation is recognized, the better the chance of preventing long-term kidney damage. So what should you do if omeprazole-related kidney injury is suspected? First, don't ignore the symptoms, and don't stop your medicine on your own. The safest step is to contact your doctor as soon as possible. Your doctor may decide to stop omeprazole and check if it could be the cause. They may also order kidney blood tests, like serum creatinine, along with a urinalysis test to look for signs of inflammation or kidney damage. In some situations, if the diagnosis is still unclear, doctors may recommend more detailed testing, and sometimes a kidney biopsy, to confirm what's going on. If the kidney inflammation is more serious, treatment may include medicines like corticosteroids, such as prednisone, to help reduce inflammation. And if you still need treatment for acid reflux or stomach acid, your doctor may discuss other options, for example H2 blocker medicines like famotidine, depending on what's safest for you. Now what about recovery? The good news is when omeprazole-related kidney inflammation is recognized early and treated quickly, many patients can have complete or at least partial recovery over the next several months, often within about 6 months. Here's another side effect of omeprazole that may surprise many people. While omeprazole is used to treat stomach problems, long-term use has also been linked to an increased risk of bone fractures. Studies have suggested that this possible risk may affect children, young adults, and older adults, including fractures related to osteoporosis. The exact reason for this possible risk is not completely understood. However, experts believe that long-term use of omeprazole may affect how the body absorbs important nutrients needed for healthy bones. Because this medicine reduces stomach acid, the body may absorb less calcium, magnesium, and vitamin B12 over time. These nutrients play an important role in maintaining bone strength. If the body does not get enough of these nutrients for a prolonged period, bone density may gradually decrease, which could potentially increase the risk of fractures. This is not an immediate effect. In most cases, loss of the bone density develops slowly and becomes more noticeable only after long-term use, usually beyond 1 year. The likelihood of this side effect varies from person to person, depending on several risk factors. 1. Existing bone risk conditions. The risk is higher in people who already have risk factors for weak bones or osteoporosis. 2. Duration of use. Long-term use is an important factor, especially when the medicine is taken for 1 year or longer. 3. High dose of omeprazole. Higher doses, especially when taken more than the usual daily amount, may also increase the risk. 4. Pediatric risk. In children, the risk may be higher when the medicine is started at a very young age, especially under 1 year, or in older children around 6 years or above. 5. Drug interaction. Risk may also increase when this medicine is used together with other acid-reducing medicines like H2 blockers. Before we end, here are a few important pharmacy tips that can help you use this medicine more safely. Omeprazole is very effective when used correctly and under medical advice. Long-term use should always be regularly reviewed by a healthcare professional. In some cases, doctors may monitor nutrients like magnesium or vitamin B12 if used for a long time. Do not stop or continue this medicine for a long time without proper medical guidance. If you found this video helpful, make sure to like, share and subscribe to replace medicine worries with real knowledge.